Hey doc, it's Nick. You have a case here that involved the patient having some symptoms on number 15. Uh, your endo testing was inconclusive, which is not surprising with these kinds of cases, especially second molars, both on the top and the bottom. You had referred out for a CAT scan, and this is just an analysis of that CAT scan. So let's take a look at the cross-sectional view here. What I'm looking for is either a crack or more commonly a response to a crack that's not visualized clinically and radiographically um, in the bone. So I don't really see anything in the way of a crack in the coronal section, which is not surprising. And as we come down in the bone, I'm looking for isolated defects that correspond to what looks like I don't want to say a vertical root fracture, but what looks like a periodontal ligament widening adjacent to a potential vertical root fracture. And I don't see any of that here. The tooth is relatively unrestored, so that's another reason why I'm thinking this is not likely a vertical root fracture of any kind. I also don't see anything in the sinus. If I saw a polyp or some sort of inflammatory reaction to, I won't say to the tooth, but adjacent to the tooth, that might suggest that there is something going on. So with your clinical examination where there was nothing conclusive other than maybe some mild percussion sensitivity and the patient just saying it felt like something was off, I always bring my attention to the occlusion. So to bring this a little more front and center, when I see teeth in the posterior, although this concept holds true in the anterior, when there's tight coupling of the teeth, and coupling means that the degree of close interdigitation of the teeth is more pronounced. In other words, all of this surface area right here, the teeth are rather close to each other, which can be normal, but if the patient doesn't have immediate anterior guidance or immediate canine guidance or group function, these teeth are not going to disclude, and there'll be more lateral forces on the teeth. And when we see that, that can cause a variety of things, all the way from TMD to widening of the PDL to fractured teeth, and so on and so forth. But it's not uncommon that the patients will exhibit kind of odd symptoms that they can't really nail down and we can't reproduce clinically. And there's nothing radiographically that it's related to this. So typically what I'll do, 2 different articulating paper colors, typically 20 micron paper, somewhere in that ballpark is pretty good for this. And what I'll do is have the patient tap and grind, and have them grind left, right, and forward with one color paper. And then you take a different color paper. I like doing red for the first one and then the second one blue, and then I have them just tap, tap, tap. And then I remove all of the red, and you're likely to see a lot of red kind of on this buccal incline surface of number 15, and possibly right here on the buccal incline of the palatal cusp, or much more. If you don't see anything, let me know, and we'll discuss some next steps on how we can come to a more definitive diagnosis. But I would start there. And the last bit is, it's not uncommon, especially the second molars, that you have what's called a distalizing interference, where the patient goes backwards. So we talk a lot about anterior guidance. Well, there's no such thing as posterior guidance. And any patient that's not in centric relation has the potential to go backwards. Doesn't mean they do, but they have the potential. And sometimes there are distalizing interferences back there. And the only way for us to find those is if the patient can grind backwards, which is hard to get them to do, or we help them do it. And a leaf gauge is the tool that we use for that. In that case, essentially you're using that red articulating paper with the leaf gauge to try to encourage them to go backwards. And it's a little more complicated than that. Feel free to watch the video on the leaf gauge adjustment on these kinds of things if you have any questions. And feel free to reach out. I'd be super curious on what transpires here, but I think it's safe to say this is not a crack.